Senator, do you think that, well, one, your thoughts about Senator Joni Ernst's comments both this weekend and today, and then your thoughts about the timeline of this bill?
Well, first, the health care improvements that we've seen over more than a generation, but particularly Medicare and Medicaid, have prolonged life, have given people opportunities, particularly when we give health care to children, which they're trying to take away. We're able to get them to the point where they can use all their skills, all their talents for this country. So the notion of death is inevitable, that's a nice philosophical comment, but it doesn't have anything to do with this health care debate. This is about making sure our country is healthy and productive, because unhealthy people can't participate fully in the economy. And that's what we should be about. And also, that's what a lot of young men and women in the uniform sacrifice for, not 5 Mercedes for the richest people in the world, but young kids can get health care and food and everything else.
I think that sacrifice is obviously a big part of what was missing with Senator Ernst and her sarcasm. Was not appreciating that in that room were her constituents, her very own constituents. These weren't somebody else. These weren't people from other parts of the country. These were people who elected her, who expressed openly their concern. And so that flippant sort of, your problems are not my problem attitude is something that I think is a big opening this summer for Democrats. As folks lie on the beaches and the full effect of what Trump is doing begins to roll across not just their television screens, but their bank accounts and their notices from their doctors, et cetera. Chuck Schumer touched on something I thought in a letter to Democrats this weekend, reminding them of what this fight is. I would like to get your response to it. Yes. He said, the fight will not just be in the Capitol. Public sentiment is everything. To my core, I know that if American people truly knew how deeply devastating, damaging, and deceitful this Republican plan is, they will reject it. So we must continue to rally the American people in the shared fight to stop this radical agenda. So it's not just about what you're going to do in the chamber.
Right.
It's what you need to do before you do what you do with your vote in the chamber. How do you see that playing out this summer?
I think you're absolutely right, Michael. And I think it was reflected in the audience in Iowa, which were these people reacted very strongly, but very honestly, because they understand that these cuts will not only take millions off of Medicaid, it'll raise the insurance premiums for every American, their premiums, and they're having a tough time paying them now. If they have a mother that they want to put in a nursing home, many nursing homes will close because Medicaid is really what keeps them open, and they understand that. They're beginning to see the attack on their families, literally. And that's why I'm seeing in Rhode Island, but across the country, people coming together and say, what can we do to stop this? We have to stop this. And again, I think Chuck is right on target. We have to connect with, rally people everywhere, and just have them stand up and say, this is bad for our country, bad for our families, bad for everyone.
Senator, you talked about Medicaid and about Medicare. I think a third contour of that is some of the tax credit expirations we could see that came under the Affordable Care Act. Republicans, of course, have a very complicated relationship with the ACA. They fought it very hard. They see how popular it has been with the American people. And so this becomes a sticky issue for them. You have outside groups. They are running ads about this because there are a lot of folks who just find themselves in the middle. They make too much money to be on Medicaid, but they simply do not have enough money to access all of the health care that they need, with incomes being what they are. I wonder for Republicans, if you get a sense when you talk to your colleagues, one, that they understand that time is of the essence here, right? That these premiums for next year get set this year, that they can't be changed by legislative agenda come the fall. And so they run the risk that they could be in the middle of an election cycle where healthcare premiums are spiking. It is their fault. I mean, I know they see it as not wanting to give Democrats a win. That seems a little bit like cutting off your nose to spite your face.
Well, Alicia, I think you're exactly right. Many of them recognize this is explosive, that there'll be cascading effects. Hospitals will close. Insurance premiums for even private insurance will go up. Like nursing homes close. All of that is going to be happening. And frankly, most medical systems in every state are very fragile. We're seeing doctors leave because they're either retiring or they want to go someplace else. And particularly in rural states and in other states. But this is going to accelerate loss of coverage. You know, I have this sort of image that where are you going to go when, well, you're going to go to the emergency room.
Of course.
And you're going to be in the street for 2 hours waiting to get in the room. And that's going to be a situation which is intolerable.
And not just a situation for you, who maybe doesn't have health care, a situation for everyone who has health care, too. I mean, this idea that our fates are not interconnected on the question of health care access.
It's hard enough to get an appointment nowadays as is. If you think about, like, folks who are trying to get into their doctor right now, if there's something wrong with you and you want to go see your primary care physician, it's not, the system is already being stress tested.
Can I just, because you both make a very important point, and I had a quick follow-up to what you said, something you said that touches on both of their points. Have Republicans in the Senate expressed to you their confidence that what you described and what Alicia and Simone have just described will not happen? That health facilities will not close, that premiums will not go up? Because you've got to have a certain level of, how should we say?
Chutzpah.
Confidence. Confidence to say that. Knowing, I mean, particularly when the CBO's already come out and said, hey, from the outside, y'all gonna blow stuff up.
Even though Speaker Johnson says those numbers don't count right now.
Right.
So, but, you know, we have some of my colleagues, Josh Hawley has been very, very clear that this is going to ruin not just Medicaid system, but the whole healthcare system. This is impossible. But I must confess, my impression is a lot of them in denial. It's saying, you know, maybe we can talk our way through this. Maybe it won't, the worst case. It'll be better than that. But more and more, I think they're beginning to understand the cataclysmic effects. And, you know, the CBO scores can be dismissed, but they're accurate.
I think sometimes when we talk about this budget, we talk about it in silos as though it's only going to affect people who are on Medicaid or it's only going to affect people who benefit from some government services. You always look at the economy as this macro question. How do you think this bill, as written now, understanding it has to go through the Senate, impacts the economy as a whole?
Well, you know, people forget that a lot of what people are paying for their monthly budget is their mortgage. It's their credit card. Interest rates are still looking to go up because of the huge amount of debt that they are taking on to finance these tax cuts. All the healthcare losses are going to mean more of those medical bills that people have to battle on. And of course, if groceries and other key essentials are more expensive, we will pay for this in one way or another.
At the core of it, though, for a lot of those folks, in addition to the things you touch on, are some of the fundamentals. All right, so it's the food I put on the table, but it's the health care I got to pay for because I got a sick grandmama. I got a husband who's not doing well. I've got my own issues, my kids. You've got the Washington Post reporting Republicans trying to repeal Obamacare again. And look, for the record, everybody know I was part of that fight.
Yeah,
no, but it's okay. Go ahead.
You know what? We'll take you. You know.
No. Look, I admit the loss then, right? We fought and we lost. The American people said they didn't want it. The Congress was able to do what they wanted to do, right? And that was 2010. Since that time, though, you have now congressional Republicans pursuing changes to the Affordable Care Act. That would mean 10.7 million fewer Americans using its insurance marketplaces and Medicaid, a huge reduction that some view as a way to accomplish part of the health care coverage cancellation that failed in 2017. So even between that 2010 period and 2017, you can make the case, repeal Obamacare, But as I said in close quarters then, and continue throughout to say, what are you replacing it with? We still need to have a plan. Republicans have never offered a plan, nothing even close to viable as a plan. Repeal and replace is not a plan. It's not a strategy. It doesn't even, it's good rhetoric, and that's about it. So for a lot of Americans, that's when it gets real for them. When all of a sudden they've got these doctor bills and these healthcare expenses that hit them, but then pre-existing conditions come back. A lot of this narrative comes back for a lot of families. How does that feed this unease that people have about what Republicans are doing?
Well, there's a real tension because on one hand, they're also saying people should have more children. People should have more families.
But they don't want to pay for the health care.
But if you're going to have no health care, if the cost of student loans and higher education is going to be jacked up, if it's more costly to get food, how on earth are you supposed to have more and more children to support when housing costs are still so burdensome and nothing has been done to address it? So to me, this is the canary in the coal mine for actually undermining how it would cost for a family to survive.
I think it's so important you keep talking about housing and these other costs that people find in that affects people in their everyday lives, because when folks talk about affordability, that is what they mean. The ability that they can afford to live how they would like to live every day. And that is grocery prices, yes. That is housing, whether it's rent or your mortgage. And I was looking at today.
Trump's bill is getting absolutely ravaged and booed down in the Senate. Again, Republicans and Democrats who are attacking it for very different reasons, sometimes reasons I agree with, sometimes reasons I think are frankly a little dumb, are nonetheless resonating, right? There's a group of people that agree. There are some Republicans that agree, sad as it is, that, hey, the problem with this bill is that it's not cruel enough to poor people. But the ones that are defending it, they're not even making that argument. You get the Joni Ernst, well, we're all going to die eventually argument. That's not the argument coming from the right-wing GOPers. That's effectively what they're saying is we don't care if the poor die. That's effectively what MAGA is saying. But politically, they're not so dumb as to say that out loud, right? Joni Ernst, though, is saying that. And so Trump's bill is failing because the people that actually could mount a defense, have the political savvy to do so, aren't doing it. Right? Look at the Republicans that have been effective at talking about this bill. The Democrats have been effective at tearing it down, I feel, from progressive, perspectives. But the Republicans that have been effective on this have been effective at tearing it down. On the one hand, you got your Hawleys saying, I don't like the cuts to Medicaid. That's not what we promised voters. The American working class deserves better, blah, blah, blah. He's being insincere, but, it's resonating. And then you have the Rand Paul, the libertarian types, who are like, no, it's not nearly enough. The tax cuts are irresponsible without even more big cuts because we're just increasing the deficit. If you're a fiscal conservative, you can't support this bill. That's resonating. Nothing else is. Again, Trump's getting pincered, guys. It's not just the left and it's not just the right that opposes this. If that was the case, Trump could know which direction to move in to win votes. But now, no matter what direction he moves in, he alienates the more moderate Republicans, the Democrats that could in some universe vote for it, but probably never will. And on the other side, the MAGA freaks that want him to be even crueler.